Welcome everybody. This is Doug McCall. I'm with the International School Health Network, and we'll be starting up this session on our global Delphi consultation in a moment. I'm very pleased to be welcoming several members of our writing team that will be guiding the consultation as we move forward. And I'm looking forward to a session that helps us to introduce the process and introduce some of the content so that people can take a look at it. The documentation will be finalized in the next few days and sent out and posted on the web. But we've taken some excerpts for this discussion just to show people how we're hoping to structure the conversation. I'm very pleased to be welcoming a few members of our writing team. We're really benefiting from a number. I'm just going to go to their names for a moment. The members of the writing team you can see on the screen now. Lloyd Colby and Rona Campbell and Hassan are online with us this morning, Sungli as well. Chris Jones I'm expecting as well, and DJ and Dan. So we're going to have several members of the writing team who have been able to join us, and they'll be making a few comments early in the session just to give us a sense of the background they have and the topics that interest them. So I'm going to go back to the first slide and just talk a little bit about what we're hoping to do today. And you can see the first item is to introduce and describe the Delphi consultation. It's accompanied by a online open consultation for anyone. But the Delphi process will be inviting about over 100 people to comment on the various statements in the Delphi process, in the Delphi document. The document is going to be finalized and circulated and posted, and so we'll be able to have both a wide open conversation as well as a structured designated consultation. And we'll amalgamate the two as we proceed. The session today as well is to look at to have a brief discussion about what we mean by knowledge and the sources and types of knowledge. And that's a facet of this conversation which might be a little bit new. Most of the time we talk about published research in these kinds of conversations, but we are going to be looking at other forms of knowledge. Also, we're going to look at the common knowledge that exists across several sectors. The material that we've developed for your consideration has been developed from a number of what we've called multi-component approaches to school-based and school-linked human development. Excuse me, it includes health promoting schools and community schools and safe schools and education in emergencies, a number of approaches that are well articulated in the research and well articulated in practice. And so we'll be trying to draw from knowledge from all of those different experiences in working with schools. There are several important themes and topics within the consultation that we're going to have a brief look at this morning. That's a part of the process as well. We're going to be asking folks to identify the more urgent or more important themes or topics or trends that people should be aware of around the world. So that's excuse me, another important part of our consultation that we'll be looking at briefly today. Item number 5, excuse me, we'll be looking at the details of the consultation process. I've taken some excerpts out of some of the documents to give you a sense of what that will look like. And item 6, we'll be looking for initial feedback excuse me, before we launch the consultation next week. So that's the overview for today. We're expecting to finish by about 90 minutes from now or earlier, and looking forward to your comments and discussion. As I've indicated as we were waiting for the session to start, you can make comments in two ways. First by clicking on the talk button in the upper left-hand corner. When your talk feature is active, the little microphone there will be blue, and please make your comment or question and then click off the button so that we have more bandwidth available for everybody else. You can also make a comment or a question through the chat box, and as you do that, you can do that at any time, and I'll come back and read it out aloud for people to focus on in the discussion. So again, welcoming everybody to the session. And just to go to the members of the writing team. Lloyd, I'd like you to just say a word of welcome for folks to hear your voice. Lloyd has kindly agreed to be our chair of the writing team. His background, most of you will know Lloyd's work from either his work in government in the U.S. or from his work at Indiana University. So it doesn't need much of an introduction. But Lloyd, if you wanted to just say hello, and then we'll go to the other members of the writing team who are online.
Great, Doug. Thank you. And it's a pleasure to meet all of you virtually. I've worked with Doug for about 25 years now and have watched him in the past 2 years develop this synthesis, which I think has enormous potential. So let me just thank Doug and all of you for your pending work to help develop it, and say if there's anything at all that I can do, let me know.
Great, thanks, Lloyd. Relna, have you been able to test your sound system, and can you just say hello briefly?
Hello, this is Rona Campbell here. Can you hear me, Doug?
Yes.
Good. Okay. So I am very pleased to be a part of this group. I'm a public health researcher based in Bristol, which is on the west coast of England, just below Wales, and I am involved in lead a number of research units. And most of our work is focused on children and young people, and particularly looking at school health. So I'm really looking forward to contributing to this enterprise. It looks very interesting and exciting.
Great, thank you, Rona. Hassan, do you want to say hello to folks? Hassan and I have not met face to face, but I'm really pleased to have the editor of a new journal on the scene, at least new in the last couple of years. Hassan, would you like to say a word of welcome?
Yes. Hello, everybody. It's my honor to be part of this great and very qualified team to work on school health promotion. I'm Hassan Julali from the MPH and PhD of Health Policy. I have worked in health system of Iran for more than 20 years, and now I'm working in Health Policy Research Center and simultaneously HIV/AIDS Research Center as Associate Professor. I have published 45 articles in peer-reviewed journals and several books in Persian language, in public health, and also HIV/AIDS. I also have participated and presented research works in several workshops around the world, and I'm coordinator of a joint project between Shiraz University of Medical Sciences and Jackson State University in the United States for designing and establishing a primary healthcare model based on Iran's experience for Mississippi State in the United States. Thank you again.
Great. Thank you, Hassan. I am going to just briefly introduce Chris Jones, who is not yet online, I don't think, but Chris is the director of the Center of Excellence on Community Schools. Chris did indicate that she was going to be able to join us this morning, so I'll just say hello on her behalf and hope that she'll be able to join us momentarily. Sung Lee from Save the Children. Sung, do you want to just say a word of welcome?
Hi, good morning. Sitting here in Vancouver, getting ready for a conference in international education. My name is Sung Lee from Save the Children. I've been working on school health with Save the Children for the past 12, 13 years, and previously with the World Bank. So looking at how school health actually is implemented through in the lower resource settings globally. I'll stop there. I guess we'll talk more later.
Great. Thank you, Sung. I am also expecting DJ, who is a professor at the Faculty of Education in one of the universities in France, but DJ has recently been seconded to work for the French government on health promotion, setting up their public health office, and so DJ, I'm also expecting him to join, as I am Daniel Leach, from who is associated with or is a member of the Faculty of Education in Simon Fraser University. And Dan is, Simon Fraser is our little host for our International School Health Network as a WHO collaborating center. So I'm very pleased to introduce the team. The rest of the members of the team you can see on the screen. It's quite varied and does represent, I think, all areas of the world. And so we're looking forward to it. I saw two other people join the meeting who were going to be engaging in a conversation along with some a little bit later on, actually on Sunday, as we are doing a similar session, face-to-face session, at the large conference happening in Vancouver, Comparative Education Conference. And I saw Laura Davison, I think, who works with the International Interagency Network for Emergencies in Education, and also Brent from the Education International, who will be joining us there. And so we're also going to have a really interesting session, very similar to this one, on Sunday morning with the folks who are present there. Most of the folks attending that conference are from the education community, and so we're hoping that that will be a big part of the conversation moving forward. And I did see Sean Slade, a long-term partner from ASCD, who's online as well, and we're hoping that there is a section of this material that will highlight some of the work that we've been doing with Sean's organization and with Education International, integrating health and social programs within education systems. A little bit of background about the Delphi Consultation, and it's an idea that I think most of us online will know about, and will have probably participated in one or two Delphi consultations before. It's basically a set of statements or a set of topics that are sent out to a designated number of people in draft form. They comment, edit, and send back, and then it's resent out one or two times in order to finalize the kinds of things that everybody can agree on. And that's essentially, in 25 words or less, the Delphi process that we're going to be following. What prompted us to think about doing this is a very similar two sets of articles that were published in the journals in two journals that we watch, where a very similar set of statements in a more narrow range of topics was used to identify better practices in early childhood education, and I think another one in terms of healthcare. So that's the process that we're moving forward on. And as I said earlier, as we waited for the meeting to start, there will be an open online session as well, where people will be able to comment on both the statements as well as the background document, and that will be integrated back into the versions that we forward back and forth with the designated list of respondents. The purposes, the why of what we're hoping to accomplish through this discussion, and it was interesting as we started to work on this project, I read an article about silos of knowledge. As we know, in school health promotion and in social development, in government or in sectors, we often work within different silos because of the structures and because of the funding. Well, that silo effect is also present and active in terms of knowledge as well. And so we're trying to break down some of those silos and to allow for cross-fertilization across the many sectors and systems and journals and knowledge accumulations that exist with regard to working with schools or in schools to promote health, safety, equity, humanitarian aid, relief aid, sustainable development, and social development. So it's a broad brush kind of approach, although I think when you find, as we go through the details of this, there are many things in common. The approaches are not the same, and we're not trying to create some sort of overarching superstructure or framework or model, but there are many things in common. So there is essentially not a core to what we're talking about there, but there are many things that are common across the different sectors. We're also hoping that by sharing widely, we're going to be able to eventually reduce some of the duplication of research that does occur. Many of you will know that I monitor over 300 journals every month to look at what's being published in relation to schools, and it's quite frustrating to see how very often research that has been done 5 or 6 years ago is being duplicated and funded again, rather than moving to a different phase on that topic or that intervention, there is duplication that does occur. So we're hoping to identify how identify some of the duplication or reduce some of the duplication by being able to essentially describe what we already know, and that's one of the purposes. A third feature, a third area that goes into the types of knowledge that we're trying to address is there is an underuse of survey and administrative data in our discussions. We often go to the published and peer-reviewed journals, but there is really good stuff that we should know and use in our practice and our policies based on survey data and based on administrative data. And so that's another sort of emphasis that we're trying to bring out to the fore and through this process. And it's actually been a bit of a learning curve for me as I've learned more about the various data sets and surveys that do exist already at the global level. It's as I say, an underused area of knowledge. And the last why that we're trying to look at is try to generate more respect and more attention to the many different reports, guides, guidelines, websites, accumulations of practice and wisdom that are published in a variety of ways by groups of people and sectors who have been working on topics for many, many years. And I'm going to use just a couple of examples. The Castle work on social emotional learning, the work on parent participation around the world, but particularly out of Australia. There's a number of experts and practitioners and policy people that work on a given topic, and their wisdom, their collective wisdom, is what we're going to try to bring into this conversation as well. It's particularly important in terms of trying to do this across the sector kind of a look, because there is as budgets have been cut back, many sectors are retreating back into more and more small bits and pieces of their work, into isolated preventive interventions and away from what we're going to describe in this conversation as multi-intervention programs. In other words, multiple policies, programs, services, practices around a given topic, be it sexual health, or be it drugs, or be it social development, or whatever. And then also, and this has been a perennial problem and you all know about this, that large frameworks such as health promoting schools, or safe schools, or community schools have always struggled to have funding for their work in regards to getting their basic components of a mandatory curriculum, a minimum set of services, minimum standards for the physical environment of the school, and so on. Getting that funded and monitored and watched and supported has always been a challenge. Another particular reason is the alignment and confusion and competition among multiple intervention programs and multi-component approaches. It's often confusing for schools as they're approached by different models. So we're hoping that as we align, as we learn more about each other's work, that we're going to be able to instinctively align things better for schools. Again, not looking to set up a superstructure, not looking to set up a super model, not trying to pretend that competition and confusion will continue to exist, but helping a little bit in terms of the alignment and of the work that's being done. And then, as I said earlier, one of the key challenges, and it would be very helpful to educators if we can get better alignment across the board, because fitting that within the context of the school system in terms of their core mandates, their constraints and concerns, is a shared challenge, a common challenge for all of us. These are the uses of the consultation that we'll be planning to do. We're going to have a wide sharing of knowledge without losing specificity and applicability through detailed statements. And Lloyd and I have talked about this as we were working on the drafting of this. As you break down items, big ideas, into practical applications and try to write that into a simple statement, we end up with a lot of statements. There's going to be over 300 statements in the draft. So that's a lot of detail. But at the same time, it's important, at least to me, that we not end up with a sort of a generalized set of things that don't have much application and really don't allow people to see what we know about those particular programs, those particular interventions, those particular contexts. And so that's the use of the, probably unique in this statement, is the fact that it's very broad and very detailed at the same time. And so that's going to be a challenge for the respondents. And one of the way we're going to be able to do that is to allow people to only focus on what they think is important or urgent or interesting in their work, and allow others to respond to the other items in that list of 300 items, so that people will be able to have a neutral response to many of the detailed statements, but it will be there'll be a lot of statements to consider. We're anticipating it's going to take at least an hour for people to go through the 300 statements and say yes or no, or editing the ones that are more important to them, but also having that option of saying, well, I can let others decide on that particular issue, and I'll be neutral on it. Another area for the use of the consultation report and results is that we're going to be able to extract topics, trends, important issues, urgent issues that should be more addressed through knowledge development. And there will be a process to develop a research agenda or a set of research agendas coming out of the consultation as well. As I mentioned, the broadening the understanding of the different forms of knowledge is another goal for the session, and we're hoping that that's going to help. And the fourth item there, the third from the bottom, is, and many of you online, I can see, have been following it as well. As many people know, there's been a new set of goals set by the United Nations on health and sustainable development, education and sustainable development. And there is a section on schooling that is goal number 4 within that set of goals. And so this intersectoral work, I hope, will have some influence on that process as we move forward. We will be sending the report to research funding organizations and donor organizations to try to indicate to them where there is a worldwide consensus on what we know and what we need to know, and so we'll be able to do that. And the last piece, and it's something that we'll take up with, there is a school health committee at the global level that's led by Save the Children, so Lee's organization online, and we'll be taking some of the results of this conversation back to that group to ask them to address different parts of it. For example, one of the themes coming out already in this discussion is on low resource countries, and the Fresh partners are quite interested in learning more and doing more about that particular theme coming out of this consultation and from other sources. This is the elements and activities of the consultation as we're moving forward. I've mentioned the first one there. We'll be having different webinars on different aspects of the consultation as we move forward. And as a way of generating more interest and participation, we'll be doing short recorded Skype interviews with many of the leaders and experts that are engaged in the process. We're going to kind of do what is your 3 most important items in a 3-minute kind of Skype interview, and they'll be available online as a recording, and that will engage people in different parts of the conversation. So the open online consultation will be occurring in those ways, and of course we'll be sending out an invitation to comment on the documents and fill in the response form as well. The Delphi consultation I've already talked about. There is an extensive list of the statements that people can download into a document and then do the responses on their computer and then send it in as a completed form. We'll also be able to do that online. It will probably take more time online, but it will be easier on the tabulation process if people can do that. There is as well an extensive background document. You'll see some excerpts later on in this presentation that people will be able to edit and comment on, and that will be available throughout the process. So I mentioned we're talking about the consultation here on this webinar and again on Sunday at the conference that I mentioned earlier. The detailed Delphi process we're hoping to finish up by the end of May, and with a final list of statements hopefully at the end of the summer, so that we can start circulating that product at the end of the summer. And I'm a little uncertain about how the process will move forward for the research agenda or the set of research agendas. We'll be collating a set of questions or topics that people think are important to learn more about, and that may end up being, as I said, a set of research agendas more than one. But I'm hoping that different people will take the lead on different aspects, and then we'll be able to support them globally in terms of setting up a research agenda for the topics that they're interested in. What do we mean by knowledge is, as I say, an underlying theme here. I've already mentioned that first point, which is pretty clear. Trying to get more use of data-based knowledge, as well as the knowledge is available in the various guidelines and stories and reports that are published by different leading practitioner groups and coalitions. There's also, and you'll see in the materials as you read through them, an emerging way of looking at knowledge, and it's different than the topic-based knowledge that is in the third point down there. That it's not looking at specific problems or behaviors or conditions or determinants and the corresponding interventions. It's a way of gathering up intervention research, knowledge about different contexts. Implementation science has emerged as a strong field. As I said earlier, the integration within education systems, we're starting to build up a bit of a body of knowledge and alternatives within that field. And of course, many of us will have read a lot about ecological and systems theory and practice. So there's different ways of gathering knowledge that, and the types of knowledge that we're hoping to consider throughout this process. This diagram, I'm sorry for trying to get, it's small text, but this is a diagram that came out of a meeting that a couple of us were involved in the Middle East, in Cairo, with the WHO office in the Middle East. And it's a way of capturing one of those things from the previous slide, that there's different types of knowledge that is being accumulated. You look at the top, implementation and maintenance and knowledge, sustainability, diffusion and scaling up. Those are all kinds of things that people are learning more about through different ways. If you look at the bottom, the community and country context, neighborhood context, people are starting to learn more about that. Low resource countries, countries that are facing emergencies, countries that have indigenous communities within them, and so on. There's a number of ways of looking at that, rural, urban, and so on. And there are people working on trying to accumulate that knowledge as we move forward, and the sustainable development too, as well. The bottom there of ecological approaches systems thinking is another newer way of approaching school health promotion and social development. And there's a number of systems concepts that relate to large, multi-level, complex systems such as education, health, law enforcement, social development, and so on. And then across the white series within that Venn diagram, you can see the different kinds of bodies of knowledge, as I've mentioned before. But that, even though that is a Venn diagram, it looks fairly neat and tidy. But one important feature that I think we need to remember as we move forward is that actually knowledge is not as tidy as this diagram here. It's actually more like this diagram here, where there's an explosion of knowledge on different topics. I'm not going to try to go through that diagram, but it's basically, it's more looking like a cauliflower or broccoli stem on steroids, as things develop in a variety of different ways and move around in a very complex and ever-changing environment. And so that's what we're trying to capture in this consultation, is that complexity, that competition among the knowledge, so that we can try to share across, not trying to change that process that is very, very disorganized, very ecological, very organic, but to recognize that that's the reality of the knowledge that we work with. Again, a quick diagram of the theory as to how knowledge is managed, with everything looking pretty organized and pretty tidy, and we can do logical planning and that kind of stuff. when in fact knowledge is much more disorganized and much more active. And if you look at this diagram, was something we did for the Public Health Agency of Canada a few years ago. There's a number of things going on with in this diagram that we don't often follow in terms of how knowledge is developed. There's often, academics working in this corner. There's practitioners working over in this corner, and it's kind of like the analogy we used was kind of like having a meal in a dim sum restaurant with a very crowded number of people ordering meal and choosing items from a series of those circular plates on the table, and it's not as organized as the previous diagram would indicate. Here's a little more structure, a little more easier to follow. This is the outline of the documentation, both for the statements and for the background document. These 10 points came out of an analysis that the International School Health Network did a few years ago when we looked at the multi-component approaches. And you'll, I think, see that it's fairly common across those approaches those 10 points. Access to schooling, social determinants and social inclusion, working in different contexts, working on multiple individual interventions at different levels, and so on. You can see the list of 10. I don't think any of them will be surprising or unusual in the conversation as we move forward. The two addendums, again, to emphasize that knowledge comes from both research and data, and so that's the 12 categories of statements and the 12 categories used in the background document. So I'd like to sort of pause a bit here for comments from members of the writing team. Here are some of the things that are emerging immediately in the conversation, and wanted to allow for people to have a chance to think about some of those themes and trends that interest them. Not necessarily, no one has had a chance to look at the material, and none of the writing team has had a chance to look at the material. So as we move in, these are some of the things that we think will emerge from the conversation, and I'd be happy for folks who are members of the writing team to comment on any of those or on the items that most concern them right now in terms of their work or their previous work. So Lloyd, if you wanted to start a little bit with a comment on any of those, or comments perhaps on the previous slide about the different 10 areas and 2 addendums that interest you, I'd be happy to stop and allow for that discussion. And then we'll have members of the participants, everybody have a chance to comment about what they think might be important to pull out of this consultation as we move forward. So Lloyd?
Well, thanks, Doug. I'm sure the members of the writing team are following this and understanding the breadth and the need for this within our own nations. I think each of us has some perspective on trying to address these issues in a more integrated way that could be useful. But when one looks at all of these across nations, it could be, as Doug has suggested, a very useful enterprise for those of you on the writing team and then others that will contribute after that to help put this on paper in a way that's understandable and usable. I would only say in addition that in some measure, as Doug suggested, at a meeting in Cairo that was sponsored by WHO EMRO, Eastern Mediterranean Regional Office, Doug actually used much of this to help shape thinking of the meeting. Sung Lee was there, Sean Slade was there, Doug and I were there, and we had a chance to kind of see how people began responding to this, which I think was supported. So in essence, to answer Doug's question about what is most of interest to me, it's actually all of them. I think they're all integrated, and I think that's part of our challenge, but particularly when one looks at items 6 through 10. We've done an adequate job, perhaps, at suggesting what the focus or what the content of multi-intervention school health programs might include. That we across the globe, certainly in the U.S., have not been focusing much attention at all on how to implement those interventions. The research and the focus in our nations has not been up to the task, and I'm hopeful that that's something that this Delphi effort and the subsequent product will address. With that, I think, Doug, your question about are there questions or comments about the product or the process that especially the team, the writing team might have, I think it's a very good question. Let me turn it back to you, having said that.
Okay, yeah, we'll save that part of the conversation to the latter part of the of this webinar. I wanted to sort of more focus on some of the content issues and at this particular junction, and then once we had a chance to look at some of the formatting of the statements and the formatting of the background document, then we can come back to some of the details of the consultation, and all feedback is welcome as we move forward. It's quite a significant process that we're starting here. Rona, could you, we've talked a little bit about the addendum A there, the sort of current state of the research and future directions, and the work that you did in the recent Cochrane review of health promoting schools. We had a conversation about the nature of research and what seems to be the future directions that we might be thinking about. Do you want to comment a little bit about that? Or is yeah, or maybe not. Okay, then we may be having a technical problem. Well, let's move to other members of the writing team. Is there any initial comment from Sung Lee or from Sung or from other members of the team who are online?
Can you hear me now, Doug? Sorry, something happened.
What might come out of this? Yeah.
You hand it over to me.
Okay, go ahead. Yeah, go ahead, please. See, I think we're having trouble with your mic. That's what I'm seeing on my little monitoring screen here. So there's probably a technical issue that we'll come back to you, Rona, when you're able to be heard. Right now, it looks like your microphone is not working. So, Sung or other members of the writing team, any initial thoughts as we look at this very broad set of issues, or a very broad set of common understandings that exist in the...
Excuse me. My concern is about the chasm between the administrative sectors and academic or research sectors, because they don't understand each other. And what happened in the administrative sectors as policymakers see some problems and decide according to their perception and follow their decision, of course. But maybe in research centers, another scenario is happening, I think, usually. And this challenge is a barrier for us, at least what I'm seeing in Iran and countries like Iran, in developing countries. This is a scenario. And I took part in a conference in the Netherlands, and I saw that many researchers that came from different parts of Europe have the same scenario. They had the same scenario, and the chasm between the administrative and research sectors. And another factor is the infrastructure is very different in different countries. So we should take into account this issue prior to each modeling, each building comprehensive model. I think so. But you should answer me that it's a Delphi, and you can put your comments. And according to the comments, Delphi with our questionnaire will be shaped, and then try to implement the questionnaire and interview with the participants, other participants. Yes?
Thank you, Hassan. Excellent point. And just to reassure you that that's the potential challenge of the different worlds that people in administration, in working in systems, managing systems, and the worlds of research and the worlds of practice are often quite apart. And I'm hoping that one of the outcomes in terms of this process will be a better understanding. So thank you for that comment. Sung, did you have a comment as well? I saw you turned on your microphone. I don't know whether you...
Okay, sorry, I was pushing the wrong. Yeah, Hassan's comment is sort of related to mine, but I did want to say, I mean, it's a very interesting lesson. It is very comprehensive, sort of like the school health and nutrition programs I work on, and that speaks to the complexity and the long. There's a reason why there's such a long list of statements. I am curious how this process will work. And I know you said we'll talk about process later, but also to make sure that we do get the right number of people involved, because there's so many topics. But I also wanted to bring up the last part about the different types of addendum B, and I think that is related to what Hassan was saying, research versus implementation sometimes, and the knowledge is talking about it as you're calling data. I think that comes a lot from actual implementers, and that having worked with so many of them that rarely have time to do the research, and then finding that the research is a little bit academic and not related to the context. I think that's where the great number of additional data is created, and we do small research, we do evaluations of program, and the number of data sets and the amount of information and knowledge that we have that's not considered research is tremendous. And I think it is an important piece in how we use that, how we leverage past experiences to actually be able to have a better understanding and common goals. I'm happy to be in this group and discussing, but I am a little bit daunted by the task.
Thank you, Sung. Members of anybody online? I know we have several people who are well experienced both in terms of their work in school health promotion and social development, but also in terms of using this technology. Any comments about the content areas that you think might be important to keep an eye on as we move forward? And I'll come back to that slide where I think these are some of the things, the themes that have emerged already from the initial conversations we've been having. Any comments from anybody online right now?
I'll just make a comment, Doug, that I think the point made before about implementation and the problems with implementation is central to what it is that you're looking at. Because there's a whole growing industry, as you're aware, around implementation science, and the complexity of the diagrams you've shown and the complexity of the human brain mean that you're absolutely going to get stuck at that process. So you can have the best curricula and the best messages in the world around the importance of well-being and the need to grow health promoting schools, but unless you've actually got professional learning development resources and support for teachers, it's not going to happen in a way that's smooth or sensible.
Thank you. I think it's an excellent comment. Further comments?
Hi, Doug. It's Bill Potts-Staten. I would just add that the funding for infrastructure seems to be an issue all over the world, and we've certainly battled that in the United States, and I think it's probably a key thing to include somewhere in this work. I greatly appreciate everyone's work.
Great. Any further comments before we move to a little bit of the details of the excerpts from some of the documents? And I'm sorry if you're hearing my colleague in crime here. It's I am using an open mic on my computer because anyway, that's our dog Alfie contributing to the conversation here, if you heard that. So any further comments about either the little bit of the common themes that we're looking at within the consultation, or some of the issues that we think are already arising out of the conversations we've had thus far?
Yeah, it's Sean here, Doug. I probably just echo what both Bill and Martin were saying. But one thing that we always struggle with from the education perspective is, one, making whatever we're asking simple enough and understandable enough that classroom teachers especially and principals can see it as a benefit to their typical day and typical work. And if they're not able to see it as that, or if there are not professional development structures that go along with it, as Martin was saying, then they're going to be looking out for some additional funding. So from the education perspective, as we've said many times, it's really keeping it as aligned to what they do, and for them to see benefit for what they typically do on a day-to-day basis.
Okay, so that's maybe one of the other themes we want to pull out of this is capacity and implementation issues, and that is one of the 10 themes within the structure, but it may be something that we want to really focus on as some of the things that are more urgent or important. And this list of other themes or trends, themes, and topics that seem to have emerged already is already there, and we'll keep an eye on those. That will be an opportunity for people to really highlight in their responses and allow for that kind of broader or more generalized thinking to also occur within this process. I wanted to maybe move to some of the details, and I'm seeing there are agreements being expressed in the chat box as well about that implementation and maintenance and sustainability issues that are there. What's showing on the screen now is actually the very first few statements, and you can see across the top of the screen that this is the tally sheet that people will be using. There is a statement number, and we've used in the document the endnotes feature of a Microsoft document where a text is extracted from the background document and appears as an endnote, endnote at the end. So the first one that we identified was item number 1, the health status, well-being, and social development and learning capacity are intertwined. So that's the draft statement. You can see it also for reference, easy reference back to the document. There is a page number. And then you can see the 5 responses that we're asking people to consider: agree, amendment, the neutral, disagree, and also adding another response, and then allowing people to edit the statement or to make a comment in that final column there. And as I said earlier, the neutral response is one that I'm thinking people will either agree quickly or say, well, I don't really know enough about that to comment. And I think those A, B, and C, or D, A, B, and C will be fairly broadly used throughout the consultation. And if you look at the nature of the statements, they're fairly, we're trying to get to a statement that is pretty easy to understand and then easy to either agree with or disagree with. And so that item there, health, the first item is probably acceptable pretty quickly in the conversation. Item 2 is another example, and it's actually probably a little bit newer idea, though. It's actually one that came out of the conversations that have been mentioned already about our meetings in WHO MRO, and where there was an agreement from the people participating in that meeting that actually maybe we needed to turn to before we talk about the health and safety and protection and equity and all those other things happening in schools, we first of all need to look at making sure that kids get into school and stay in school. And so that was, again, the first kind of a comment, first kind of a statement that people can look at. It's newer. It's not as traditional or as easy to understand as the first one. And that's why we've provided the background document for people to go, well, I'm not sure what you mean by that. They can go back to the background document and get some other sentences around the statement so they can understand what we're trying to say in the statement. The third area, and it's just an example, is throughout the document, in the background document, we have used the comment feature as a way of pulling out research needs, topics, and even research questions if they can be formulated. And so within the statements document, we'll have this kind of a format where people can look at what research or new knowledge is needed around the topics that are currently looked at on that page. And so that's the format we thought we would use there. Again, allowing people to add to it and comment on it and so on. So that's the sort of the format for the for the consultation. Here's some more excerpts which are different insofar as this draft does not include the final answer on many questions. And if you look at items 61, 62, and 63, you can see that there's a to be added section. And we're hopeful that people who are interested in those areas, these are just 3 examples, will actually fill in the blanks and help us with in the second draft to, in this case, in terms of item 61, list the individual interventions that can affect the issues in high-resource countries. Or 62, what are the issues and programs that are important in low-resource countries. Excuse me. So that's another feature, is that the first draft does not have full and complete answers or statements about all of the things that we could consider. It was just not possible to do that in this draft, and hopefully the consultation and the open consultation people can add content and come back to the second draft. And it's going to be another challenge for the process, but I think at the same time we're going to be able to collect a lot of knowledge and wisdom from a lot of different sources. These are some other examples from the statements. You can see again the statement 76 is on social emotional learning, and it's sort of reaching. It does reach a conclusion about what the research and knowledge and data have shown, that social emotional learning can promote positive social behaviors, reduce conduct problems, and improve academic performance. So that is more of a conclusion kind of a statement based on what we know. And so that's the kind of format for many statements. There are other statements that use the format of that we should be doing something. We know from common sense or from our principled actions that we should be doing something. And so there are statements that say should in some cases. We try to limit that so that it doesn't become a should document, but rather what we know. But if we do truly know that something should be done from common sense and from experience, then we can put it down in terms of a simple statement. And so those, you can see some of the statements get a little long, and editing can help to shorten them, but again, hopefully they're pretty clear and pretty straightforward in terms of their meaning. And if they're not, we can edit it through the process. So those are some examples in a traditional area of instruction, and hopefully it gives you a sense of the topics. This is an excerpt from the background document, and I pulled it out because just to show, first of all, the format used in the background document, and then secondly, a little bit of the nature of the background of the content. So if you look in the left-hand column, there are a number of words that are underlined, and in as many cases as we can throughout this process, those underlined words will lead to a brief glossary term kind of definition that people can use if they want greater clarity about the concept that's being discussed here. And so there'll be links back to a Wikipedia-style website that we've been building over several years. So people can look at the summary on the left-hand side, and then click if they want to understand what we're talking about in that item. That's been the challenge of adding that many concepts in the work. We're lucky that we've had a pretty good start on it over the last few years, but we still need to be able to have the terms discussed in a common way. And then if you look at the right-hand column, that's where the statements come from. Very often it's either, as you look at the first one there, where the interagency protocols and seamless procedures should be in place to ensure coordination about schools and police services and so on, youth courts. That's a pretty clear statement and ends up in the bottom of the document in terms of a draft statement. There are other examples in the background document where there might be 3 or 4 statements, and then one of them is extracted, or a summary of those 3 or 4 statements, 3 or 4 sentences, is summarized into a statement to be tested in the Delphi consultation. So it hopefully provides a bit of context for people to read. If they want more, they can go to the left-hand column, and if they want more, they can go to the web-based version explaining the concepts. All of this document, as well as even the glossary terms online, can be edited and commented upon if people want to follow a thread all the way through. That will be a larger demand on respondents that I'm not sure many will be able to do. I think getting their response to the statements will be a big enough challenge, but we're offering that opportunity as well, so people can follow all the way through and correct both the material in the left-hand column or go back into the website and correct the starting point for the conversation. And you can see the format in terms of how the background document is structured. The other point I wanted to make about this particular slide was that the breadth of the different sectors. This is talking about the crime prevention or law enforcement sector, and has a number of things that we sometimes talk about in health promotion or sometimes talk about in community schools. And by the way, I saw that Chris Jones has joined us, so Chris, jump in whenever you get a chance. I'm hoping that you're going to be able to add your voice to this discussion as we move forward. But if you look at the format here, people will be able to edit the background document or comment on it, and we will do the editing, and also be able to extend right back into the web if they want. But hopefully the right-hand side provides a bit of context for the statements as if people want to go to that point. The next idea, and this is interesting because we were talking about implementation and capacity, the statements, one of the themes is implementation and capacity building, and as people have already said in this webinar, we need to have a clear idea about the human resources that are required, or the time in the curriculum that is required, or the financial resources that are required, and actually to be able to implement and maintain something. And that's not often a conversation that occurs. And we've even broken that down into different kinds of capacities based on those things on the screen right now. And there's a body of knowledge about capacity building that is growing, and so that's reflected in the statement. So that's the general point that we were talking about earlier, but we want to break these down into practical terms at the ground level, bring them right down to earth. And so this slide, and I'm sorry for the small text, couldn't get it any bigger, but this is one of the capacities that we talked about in the previous slide. It looks at being able to assign staff to coordinate things. And this column here is a description of that. And then this set of points drives down to the issue of being able to coordinate things at different levels and assigning coordinators at different levels. And so there are a number of specific points, hopefully, that capture some of the earlier conversation we started, that make it clear that this capacity is needed, and that in many cases that capacity is not yet present in many systems. And so that's the kind of driving it down into detail that I hope we're going to be able to use in this consultation. The challenge is the number of statements, but getting it down to a practical level means that we need to be getting down to the nitty-gritty, and so that's the challenge of taking that big idea around coordination and putting it down to something that we can describe as to whether or not exists or does not exist, and so on. And you can see that, for example, the very bottom of that draft, of that excerpt, the school nurses being the logical personnel to be able to coordinate things at the school level with regard to health promotion. Again, that's a pretty clear idea of who is probably the best personnel, which is the best personnel, category of personnel to take on that role at the school level or perhaps at the agency level. So that's sort of driving it down to the detail level that we're hoping to be able to do. This is another example of a different kind of idea, and Lloyd, you'll be familiar with this because you're doing some work with one of the countries in the Middle East in terms of this big idea, and it's an idea that we discussed in a recent forum in Ottawa with in a North American forum between many Canadian and American organizations about the nature of the partnership between the Education Ministry and the Health Ministry. And the new idea, which is emerging from that conversation, and it's part of the theme that Sean and others have been working on, is that there needs to be a really truly negotiated, strategic, and stable inter-ministry and interagency agreements at those levels. That is, gets down to the real deal in terms of budgets, staffing, resources, profile for their respective ministers, and all those things that senior people in education ministries and health ministries worry about. And so that's trying to get to perhaps a new conversation, or one that's emerging from the discussions that Sean's group is leading, but it is getting down to formalizing that idea in terms of a statement or two that people can think about. And so that's taking a strategic idea and getting it down to the nitty-gritty level as well. And so that's, if you look at that's the statement here, and then it goes to different comments or different statements throughout that, dealing with that particular issue. This is another example. This is from the addendum on the current state of the research and future directions. And Rona, I'm not sure if we're going to be able to hear from you, but these are some of the ideas that they're actually being quite debated now in terms of, if you follow the Cochrane collaboration, they have a really interesting newsletter that talks about their methodology of systematic reviews, and so there is a discussion that's been occurring. There's a kind of a general debate about whether random control trials and systematic reviews are appropriate for measuring in complex interventions in multi-level complex organizations. And so that's one of the areas that we've tried to develop some specific statements on, and to get down to a real discussion about whether we can accept those statements or agree with those statements. And so, again, it takes an area that we're not used to talking about often in terms of RCTs and systematic reviews and the value and limits of those, and trying to drive it down into particular statements that address that issue. And so, again, it increases the number of statements involved, but it also allows us to be able to state what we know about systematic reviews and RCTs. And I'll go to another example. That's the same conversation, research methods. I'll maybe not dwell on that particular example, but that's one of the areas that would be part of the set of statements coming for the Delphi consultation. And then this is an example from one of the addendums, the Health Behavior in School-Aged Children Survey. Most of you will be familiar with it. It's a widely used survey in 44 countries in Western Europe and North America. And the right, and people will be able to go through find that online and be able to follow it through. And then we've described what that survey does, and also what the survey has been telling us over the last several years at the global level. And so you can see in this section a number of things that the researchers, that's a very strong research network associated with the HBSC survey, what they have learned and what they've told us in terms of what they know based on their surveys that have been done 4 different times over the last several years. And so that's knowledge that perhaps people will not be following as closely, and again, it's something that we're going to try to bring into this statement, into the set of statements. Another, perhaps a little less than usual, at least for me at least, is finding out about the different data sources that do exist. And here's an example that UNESCO has a really good set of statistics and databases that they track. And you can see that I haven't had a chance to, and it's been part of the challenge of following through to see what might be relevant to pull out of that. But here's one that might be, that we have been following. All of us, I think, online will know about the Millennium Development Goals that ended in 2015 and the new Sustainable Development Goals for 2030. And some will know that there is a consultation just being finalized this coming month at a committee level, eventually going to a UN meeting in September for the indicators that will track the achievement of those indicators over the next 15 years or so. And some of us have been watching the development of those indicators with some trepidation, which is hot on in. So these are the documents with the links to those documents, and this is the facts of the matter in terms of where the indicators stand currently. And so, again, knowing that this is being worked on and knowing that this is the current state of the art is, I think, helpful, and I think underlines the importance of being able to influence data and data collection and indicators and so on. So that's again part of the drafting of the document, and adds to the length, but again, I think adds value if people take the time to go through all of it. So maybe I'll stop here and look for comments about process, and go back to our original the process that was outlined in the earlier slides. Where is it here? There. That's the process that we're thinking about doing, and maybe we can have a general discussion and advice about how we can move forward. Just to recall then, people are going to be asked to look at about 300 statements, simple statements as you've seen online, to say yes or no, or to amend, or to comment on, or to have a neutral response saying that it's acceptable to them, but they're not really actively agreeing with it, which is again part of the Delphi process, is to see either agreement, strong agreement, or acceptance of an item. And then also the background document, you've seen excerpts and see how that's been structured. And this is the process as we've planned it thus far. So again, opening up for comments and questions about the process, and be able to seeking your advice about how to manage it effectively as we move forward. Maybe, I don't know, Lloyd, you've had a chance to talk a little bit about with this with me, and any questions, comments. So Lloyd, if you wanted to introduce any ideas at this point, please do, and then open it up to everybody.
Thanks, Doug. It may be important to say that as we've gone through the consultation, I think Doug's done a remarkable job in presenting a lot of ideas to you all. I'm sure it will take time to chew through them. But I've been carefully taking notes about what people have said to this point in time, and will continue to do so on the rest of this meeting. And I've used the recording function, so we should have an even more detailed assessment or transcript of what people have suggested to this point. So I think the comments have been quite useful already, and certainly the writing team, we want to hear from them. The comments that we've heard also from people who are not on the writing team have been very useful. I think the complexity of doing this is reflected. We've certainly talked about it in the past, and we've heard it again today. To say how broad and detailed should the document be, how long should it be versus how short should it be for writing, and saying this in very, very simple terms. And that's something that I think we'll continue to be addressing. I think we've heard very clearly comments to state that it would be helpful to focus on implementation, dissemination, strategies to get this into place. Not to say that the more detailed analysis of what is included in any particular component is unimportant, but at least to date we've heard that comment. Doug, those would be my assessments at this point in time. Let me turn it back to you, if I might.
In the chat box, which unfortunately Lloyd's machine is not showing, Yvette has made a comment, which is one we've really been aware of, and we're trying to address as best we can, is the number of statements. It will be a very challenging response for someone going through as a respondent. We're asking, the idea is that respondent is asked to go through each of the statements and either agree, essentially pass in neutral response, or disagree and seek amendment or comment. We're hoping that most of those 300 statements will be fairly easy to understand and either agree or disagree with. But Yvette is right, is that there is it's a large number of statements. I don't, Yvette is asking whether there's an ideal number of statements. Well, I don't think there is, but in order to get to the depth that we've talked about, and I tried to explain why that depth is we've seen it as being necessary, then it just generates that number of statements. It's not avoidable as a facet of the consultation. But we are hoping that with the dedication of the folks to the process, certainly the 100 respondents that we will track closely, as well as the open area. And the open area is less demanding in that people can pick and choose what they really want to comment on, or respond to, at their leisure online, is an area where they can pick and choose. So. And my sense is that people will scan most of the statements and focus in on the ones that are more of interest to them, and hopefully comment on 20-25 statements in depth. But that's my hope, and we'll do some field testing of the instrument before we move forward to see that some of the assumptions that we've been making are true. But again, it's a real challenge. Hopefully a challenge that we can meet by a couple of different methods, but it's definitely a challenge.
Doug, would it be helpful to say anything about Brazil and the next step with this?
Well, yeah, just briefly, we're hoping the process will be complete by late May. There is a school health symposium in May that we're going to as our traditional 2-day event prior to the IUHB event, so we'll have a chance to do this face-to-face and go through the text, go through the results, and get feedback there prior to writing the final report and the final list of statements in June and September. It may very well be that the May meeting will say, yes, this is good as a draft, but we need to go back to people with one final check. Hopefully at that point it's more looking at the items that were still in flux, rather than, we won't be going back with asking people to redo the statements. We'll be going back with what has changed over the summer months.
Excuse me, Don. Is it possible to have access to recorded file?
Sorry, can you speak a little louder, Hassan?
Yes. Excuse me. Is it possible to have access to recorded file? I think this meeting is recorded. So I would like to again listen to the speaking conversation, this meeting, because I have some problem with the software and it disconnected several times.
Yes, certainly. There will be a recording, and we'll post it online, and we'll let everybody know where that recording is located, and it will take you right into the meeting, so you'll be able to hear the whole thing. So yes, there will be a recording of the session.
Thank you. Thank you.
So further comments about the process and or the, and you can send if you like, if you've got ideas that you wanted to just send to me directly. I think everybody has my email address, but it is at the end of the, just display it. You can send me any comments you want individually about the draft materials, and I'd be happy to try to incorporate them into the text.
Hi, Doug. This is Sung again. Quick question. The schools4all.org, is that open to all now? Can we use that and send people to it now?
Yes, and it's a wiki-based website, so you'll be able to edit or comment on the draft summaries that are there as well. It's
Great.
Quite a large website, but and you might want to work backwards from the background document because the website is quite extensive. It has a lot of material on it.
Okay, and then talk about the process, and I was also concerned about the number of statements, and I guess this is my question about how many people can we get interested if you're aiming for 25 to 20. Let's say, like you said, like people who are interested are focusing on you and their topics, and trying to get the right number of people who are interested in the right number of statements to get a really good feedback. I guess I'm not sure what we're planning, how we're going to keep an eye on that to make sure that it's not just one person who's passionate about 3 statements that's making all the decisions about those statements because they're the only ones who are interested. I guess that's what the whole point of Delphi is, to actually have enough people interested in those topics. I don't know if that makes sense. That's something to think about. And the other one is I was reading one of those comments, and so we're trying to reduce to a level, a fewer number of statements, but I was reading one and I'm like, oh, this is going to create a lot more statements. So I don't know how we're going to look at it if we come up with the statement that a lot of people are interested in. It actually creates more as opposed to fewer statements.
Yeah, going to the first point, the technology that we're going to use, and I think you used it too, the Google survey will give us a tabulation of the approximately 100 people that will be formally invited to respond. And we'll follow up with them to persuade them as best we can to respond. So that will be the traditional Delphi process. And I am hopeful that we'll have a pretty high response rate from those 100 people. And each of their responses, it's a required response to every statement. And so we'll be able to see how many people agreed with any particular statement or disagreed or were neutral or suggested even the amendments or comments on it. So we'll be able to track that fairly closely and send that back to people as part of the second draft of the statements. So that will be managed through that technology, through the tabulation using Google. The broader conversation about when we start a conversation about something and there are more statements, we'll be able to track that in terms of the editing that occurs, the comments that will be occurring, again using a Google Doc format, as well as I think a fair number of people will just download the document and write their comments or make their edits and send it to us, and we'll be able to track that. And those conversations will be picked up, I'm hoping, through that section of this presentation that looked at different topics or trends or that are more urgent or more important. And so if we see a lot of different sets of statements coming out in response to something, then we'll be able to say, oh, that's an area that we need to try to organize a more structured conversation about on the web, probably, most likely. And that's another part of the reporting. So if we see that there's a debate that's occurred about a particular item, or people really agree that we really do need to know more about this area, and that will be part of our report. And we'll identify those themes and topics and trends that, excuse me, that have emerged from this process. It will not be as tabulated as the tracking of the statements, but it will certainly capture the feedback and the conversations that have occurred. And we'll be able to put numbers on the comments as well, number of people commenting and so on.
Thanks for the explanation. That's really useful.
Thanks. Well, this is, you know, I think there are 100 people. I think we've got 20 of them online right now or more who are really interested in this. And I think when people see the breadth and the depth of the knowledge that does exist in the world, I think it's going to generate some excitement based on what, even in writing the material, it was very interesting for me to just learn and have a chance to think about the breadth and the depth. And I think that's the opportunity we're offering people for their own knowledge development. It certainly has been a learning curve for me, and as I say, that the learning about the data sources, learning about as we learned in terms of really understanding from the work in low resource countries and emergencies in education, the kind of process we had in the Cairo meeting, where really we need to focus first on making kids get into school and stay in school. That's something that I should have known 25 years ago. And so that's the kind of learning I hope will occur throughout the process for everybody in different ways on different topics. Further comments or questions about just going back to the process here.
Doug, this is Leanne. I see that you had a question
please.
From Rona Campbell on the research agenda. So I wondered if you could talk about that. I'm also curious.
Sorry? Yeah. I'm just getting to that. Okay, yes, thank you. Thanks, sorry, Rona, but just doing two things at once here. What we're seeing, I think, as people respond, and there will be a chance for them to look at a series of potential questions, potential research topics that are pulled out of the background document and listed. And so we're going to get feedback on those in a similar way to the statements. It's going to be a little wider open, I think, in terms of the conversation, because I don't think we're going to be able to get to any kind of quote-unquote research questions in this initial conversation. But we're going to gather up what people want to know more about, either in amendments to the background document or in terms of formal responses to the tentative items we put into the statement/research topics document. From there, we're hopefully going to be able to see some trends and some topics that people really are interested in. And so that will, as a writing team, be able to see the topics that are the research issues that are emerging, and then we'll be able to say, okay, this is an area that the people seem to be interested in. So we will propose back to folks, and using our broad networks as well, to say, are there people interested in really sitting down and doing a research agenda on this topic or this area and moving it forward. And that will, again, be part of the report out from this process. Is we're going to be able to say that in the respondents, both the designated respondents and the open response, these are the research areas that seem to be emerging, and these are the agendas that might be developed from that, and we'll inform research funders, and of course we'll circulate it broadly around the world in terms of researchers. And so that will be the process. And I'm thinking there's going to be some themes and topics that well, I see some already in terms of some of the areas that people are already working on. So I think that's going to be, that will be the nature of that process. And hopefully that answers your question, Rona. Other questions or comments about the process? And again, if you get a question there about do we have a list of the participants for the Delphi consultations? Short answer is no. I will be asking members of the writing team to suggest people who should be on that list of designated respondents, and I have a number of people already on a draft list. So anybody on this line, if you want to be involved, please indicate that to me by email, and I'll be happy to add you to that list. And then we'll do a bit of a check as to background of people, so that we've got a good balance across the different sectors and from different parts of the world, so that we're able to have a good representativity of a number of different factors in that designated list. So if you have a suggestion or would like to volunteer, please send me an email, and I will. And the next step for me is to send a draft list to the writing team for their comments and suggestions. Are there other further questions or comments? Okay, can we, Lloyd, do you want to, thank you very much for everybody. I hope this has been helpful to help to start us out on this Delphi consultation, and really appreciate your attention and time and comments as we move forward. And Lloyd, do you want to just say anything as we finish up the session?
Well, maybe only to say, Doug, I think you nailed the time. I've got 10:28 Eastern time here, so you had scheduled an hour and a half for this and met that timeline. Covered quite a bit of material, and thank you for all that you've done on this, Doug. I think it's been a remarkable effort. And to be sure to echo your comments, thanks for everyone else who's beginning to work on this. I think it likely will be a benchmark in school health, and certainly in international school health. It just reflects how much more we could do if we had experts like those that are gathered on the phone today working together instead of working independently. So thanks, Doug, for all you've done.
Thanks. I just wanted to go back to our list of members of the writing team. Many of whom could not be online today because of their scheduling, but who will be active and participating in the process through email. And you can just see the breadth and depth of folks that are involved here. It's I'm really pleased with the responses to the start of this. So.
Could I just say I'm sorry for arriving late. I have problems with the technology to start with, but I gather from the comments I've heard that it's been a very useful session, and I'm looking forward to being part of the writing team.
Great, thanks, Chris. I did introduce you knowing that you were trying to get online, so thanks. Other comments? Otherwise, if folks I'm just going to turn off the recording, and if people wanted to have anything else to, let me just, oops. There, the recording.